Hello, my name is Jones Muna. Today, we look at 1. Diarrhea in children. Diarrhea is a common cause of death in infants worldwide. The loss of fluids through diarrhea can cause dehydration and electrolyte imbalance. Most children who die from diarrhea actually die from severe dehydration. In developing countries, children under 3 years old experience on average 3 episodes of diarrhea yearly. This results in malnutrition, and malnourished children are more likely to fall ill from diarrhea. Diarrhea is the condition of the gastrointestinal tract affecting the intestines, in which there is frequent passage of 3 or more loose or liquid stools in 24 hours, or more frequent passage than is normal for the child, caused by ingestion of contaminated food or water by microorganisms. Often characterized by vomiting, passing watery stools and signs of dehydration such as sunken eyes. Kindly note that frequent passing of formed stools is not diarrhea, nor is the passing of loose pasty stools by breastfed babies. The route of transmission for most diarrheal disease is via fecal-oral route. This includes ingestion of contaminated water or food. It can also be transmitted person to person through handshake. Diarrhea is caused by microorganisms such as bacteria, salmonella, shigella etc., viruses, rotavirus etc., and parasites, worms. The predisposing factors may include failing to breastfeed exclusively for first 6 months because this causes early introduction of other foods that colonizes the gut lining of the child with bacteria. Use of dirty infant feeding bottles, drinking water contaminated with fecal bacteria, poor disposal of fecal by mothers such as diapers, poor weaning practices, age group thus 6 to 11 months, etc. The signs and symptoms of diarrhea include the following: frequent passage of watery stools, general body malaise, vomiting, abdominal pains, fever, excessive thirsty, signs of dehydration such as sunken eyes and fontanelles, poor skin turgor, oliguria etc. Diarrhea may be treated according to cause. You can give zinc sulfate 10 to 20 mg, antibiotics, paracetamol 100 mg. Fluid therapy is cardinal with either oral rehydration salt, ORS, or intravenous fluids. Management of diarrhea is therefore according to the level of dehydration. The World Health Organization, WHO, recommends a simpler system for use by both physicians and lay health workers, which classifies dehydration as 1. None dehydration, for treatment use plan A. 2. Some dehydration, for treatment use plan B. 3. Severe dehydration, for treatment use plan C. 2. Expanded Program on Immunization. The Expanded Program on Immunization, EPI, is a World Health Organization WHO program with the goal to make vaccines available to all children throughout the world. The World Health Organization, WHO, initiated the Expanded Program on Immunization, EPI, in May 1974 with the objective to vaccinate children throughout the world. In 1984, the WHO established a standardized vaccination schedule for the original Expanded Program on Immunization vaccines: Bacillus calmette-guerin, BCG, diphtheria, tetanus pertussis, DPT, oral polio and measles. Increased knowledge of the immunologic factors of disease led to new vaccines being developed and added to the Expanded Program on Immunization's list of recommended vaccines. Zambia adopted the goal of universal childhood immunization, UC, meaning that all children aged from 0 to 5 years must receive BCG, measles, OPV, IPV, DPT, Hep/Hib, PCV and Rota vaccines according to the scheduler soon thereafter. Let us appreciate the meaning of the following terminologies: immunization, vaccine, and vaccination. 1. Immunization is the process of protecting a person against a disease by introduction of a suitable antigen in the host's body. 2. Vaccine is a suspension of microorganisms which are either killed or attenuated. This is prepared from living organisms which through long cultivation have lost their virulence, used to protect against disease. 3. Vaccination. This is the inoculation with the vaccine in order to protect against a disease. Guidelines of child immunization. A. Immunization should not be given at a younger age than that indicated on the schedule. B. Vaccines, which require repeat immunization, should not be given at shorter intervals than indicated on the schedule. C. Immunization should not be given if a child is acutely unwell with fever. D. All infants should be immunized. No child should be refused to receive vaccine except in person with impaired immunity, symptomatic HIV infection or known allergy to vaccine component. Target groups for vaccination: children under 5 years, school-aged children, pregnant women, women of childbearing age, and special at-risk groups such as travelers. Importance of vaccination include: 1. Protection of children against preventable diseases. 2. Protect the children from serious illness and complications. 3. To boost a child's immunity. 4. Helps to prevent diseases during outbreaks of certain disease. 5. Vaccination also helps to protect a pregnant woman and her developing fetus from having certain diseases. 3. The flow of cerebrospinal fluid. Cerebrospinal fluid, CSF, is a clear fluid found within the ventricles, cavities, of the brain, central canal of spinal cord, and beneath the cranial and spinal meninges in the subarachnoid space. It protects and nourishes the brain and spinal. The meninges, dura mater, arachnoid mater, and pia mater, are the three membranes that envelop the brain and spinal cord. Cerebrospinal fluid is located in the subarachnoid space between the arachnoid mater and the pia mater. The primary function of the meninges is to protect the central nervous system. The whole process begins when cerebral spinal fluid, CSF, is produced by the choroid plexus in the lateral ventricles. Cerebrospinal fluid will flow through an opening called the foramen of Monro to enter the third ventricle. From the third ventricle, the cerebral spinal fluid continues to flow downward into the fourth ventricle, passing through a passageway called cerebral aqueduct of Sylvius. In the fourth ventricle, the cerebrospinal fluid will continue the journey flowing downward into the spinal cord. Nevertheless, some fluid will pass through the foramina and the roof of the fourth ventricle called foramen of Luschko, also called foramen of Mangendi, to enter the subarachnoid space. The cerebral spinal fluid will circulate through the brain and spinal cord in this space, subarachnoid space, and passes back or be absorbed into the blood through tiny diverticular of arachnoid mater called the villi, which project into the venous sinuses. Balance between production and absorption of cerebrospinal fluid is critical. Because cerebrospinal fluid is made continuously, medical conditions that block its normal flow or absorption results in overaccumulation of cerebrospinal fluid. This results in pressure against the brain tissue, causing hydrocephalus. 4. Asphyxia neonatarum. Asphyxia neonatarum is a condition in which a viable newborn neonate fails to initiate and sustain respiration shortly after delivery. Newborn neonates normally start to breathe without assistance and usually cry after delivery. By 1 minute after birth, most neonates are breathing well. Nevertheless, if a neonate fails to establish sustained respiration after birth, the neonate is diagnosed with asphyxia neonatarum. Drugs like narcotics that are given in the second stage of labor to manage pain may depress the fetal respiratory center, hence the neonate will fail to establish respiration at birth. Other predisposing factors include 1. Prematurity. 2. Blockage of the airway. 3. Prolonged labor. 4. Intracranial injuries. 5. Post-maturity. This condition begins even before birth of the neonate. The most common isolated cause is due to fetal hypoxia, which may be due to disturbances in the oxygenation of the fetus. Due to hypoxia, the fetus will respond by accelerating its pulse rate in an effort to maintain supplies of little oxygen in the bloodstream to the brain. Further, if hypoxia persists, there will be abnormal accumulation of carbon dioxide in the bloodstream, leading to acidosis and fetal brain swell, which may depress the fetal respiratory center in the fetus, will relax the anal sphincter and pass meconium in the liquor, resulting in aspiration of meconium by the fetus. Now, due to these effects, the neonate will fail to initiate and sustain respiration at birth. Asphyxia neonatarum is an emergency in obstetric, so it needs quick interventions to avoid complications like brain damage. The aims of the management is to 1. Establish and maintain a clear airway. 2. Establish effective blood circulation. 3. Correct the acidosis. 3. Prevent hypothermia, hypoglycemia and hemorrhage by giving vitamin K. 5. Mumps. Mumps is an acute viral disease of the digestive system, affecting the salivary glands, parotid glands, caused by a virus called mumps virus rubulavirus, a member of Paromyxoviridi, characterized by localized bilateral or unilateral edema of the parotid glands, fever and dry mouth. It is spread by airborne respiratory droplets, thus when coughing or sneezing. Direct contact of respiratory secretions, such as touching contaminated surfaces. It can also spread by saliva through kissing or shared drinks. The incubation period is 12 to 28 days with an average of 18 days. The predisposing factors may include unvaccinated children who do not have evidence of immunity. Age of 2 to 12 years. International travel, especially to countries without mumps vaccination programs. Living in close proximity to infected individuals with rubulavirus. Immune deficiency in babies born to infected mothers with mumps. The salivary glands are exocrine glands that produces saliva through a system of ducts. Humans have three paired major salivary glands, parotid, submandibular, and sublingual, as well as hundreds of minor salivary glands. The parotid gland is a major and largest salivary gland. The parotid glands are present on either side of the mouth and in front of both ears. Each parotid gland secretes serous saliva through the parotid ducts into the mouth to facilitate mastication and swallowing to begin the digestion of food. When the virus enters the body, it infiltrates the epithelial layer of the airway. It starts to multiply and later enter the bloodstream to reach the parotid glands. In response, the lymphocytes infiltrates the gland tissue, which leads to inflammation and swelling of the parotid gland. This causes changes in the drainage ducts of the parotid glands leading to obstruction of saliva flow, hence the child will present with dry mouth, fever due to infection, and difficulty in swallowing as a result of the inflamed gland. Viremia is also common through the bloodstream. The virus in severe cases can also affect the testes, ovaries leading to infertility. Can affect as well the pancreas and kidneys leading to impairment in renal function. The treatment is symptomatic because the condition is self-limiting, so give supportive treatment. This includes fluid therapy, local application of cold compress to the neck to promote comfort, for fever and pain give analgesics such as paracetamol, maintain adequate nutrition, and give soft foods. 6. Ophthalmia neonatarum. Ophthalmia neonatarum is a form of conjunctivitis that affects the newborn babies within the first 28 days of life. The baby's eyes are contaminated in the colonized birth canal of the mother by Neisseria gonorrhoeae or Chlamydia trachomatis during delivery. Ophthalmia neonatarum is a severe condition affecting the neonate's eyes in which there is inflammation of the conjunctiva, the membrane that lines the eyelid, and the exposed part of the eye, usually caused by Chlamydia trachomatis and Neisseria gonorrhoeae, characterized by irritable red eyes, swollen eyelids and purulent eye discharge manifesting within the first 28 days of life. There are several possible causative organisms, but the most common are Chlamydia trachomatis and Neisseria gonorrhoeae. Others may include Staphylococcus aureus, Escherichia coli, Pseudomonas, Haemophilus influenza, herpes simplex virus, chemical irritants, etc. The predisposing factors are 1. Traumatic deliveries. 2. Premature rupture of membranes. 3. Maternal infections, STIs. 4. Lack of antenatal care, etc. There are two major types of ophthalmia neonatarum. 1. Infectious septic ophthalmia neonatarum. 2. Non-infectious aseptic ophthalmia neonatarum. Infectious ophthalmia neonatarum can be caused by either bacterial or viral infections. The baby gets the infection from the mother while passing through the colonized birth canal during delivery. The subtypes of infectious ophthalmia neonatarum may include 1. Sexual transmitted bacterial infection. This may include organisms Chlamydia trachomatis and Neisseria gonorrhoeae. 2. Non-sexual transmitted bacterial infection. May include organisms Staphylococcus aureus, Escherichia coli, Pseudomonas, Haemophilus influenza, etc. 3. Ophthalmia neonatarum due to viruses. Viruses such as herpes simplex virus type 2. Chemicals cause non-infectious ophthalmia neonatarum. The prophylactic silver nitrate solution application used in newborns to prevent spread of infection. This silver nitrate has a tendency to irritate the conjunctiva of the newborn's eyes and can lead to serious form of sterile conjunctivitis. 7. Leukemia. Leukemia is a malignant disease that is characterized by hyperplasia, rapid multiplication of white blood cells and their precursors. It is a form of cancer in which the body produces too many abnormal white blood cells. One of the function of bones is hematopoiesis, which is the process of production of blood cells, which continues throughout life replacing aged cells. Normally, blood production occur in the bone marrow to a specific stem cell called hematopoietic stem cell. During blood production, hematopoietic stem cell give rise to two main blood precursors, namely 1. Myeloblastic lineage. 2. Lymphoblastic lineage. The lymphoblastic lineage will mature to form lymphocytes, which are white blood cells. This further will be divided to form B and T lymphocytes. On the other lineage, myeloblastic lineage, the myeloblastic precursors will mature into erythrocytes, thrombocytes, and leukocytes. In this lineage, leukocytes will further be divided to form granulocytes and monocytes. Once the various blood cells form, they leave the bone marrow and travel around the blood vessels to perform their various functions. Erythrocytes carry oxygen to all parts of the body, white blood cells fight invading foreign invaders, while thrombocytes are involved in the process of blood clotting. The actual cause of leukemia is unknown, however, the predisposing factors may include 1. Exposure to radiations. 2. Exposure to chemicals such benzene. 3. Some viruses. 4. Generics because it tends to occur in some families. 5. Chemotherapy. These factors disturb the normal production of blood cells inside the bone marrow, resulting in hyperproduction of the white blood cells only. Leukemia has two effects on the body. First, the white blood cells may not mature properly as they develop. They may lack the ability to kill microorganisms in the bloodstream. This defect seriously damages the immune system, and the body loses its ability to fight infections. This will then lead to frequent infections, enlarged lymph nodes, fever, etc. Secondly, so many white blood cells may form that they pack the bone marrow until there is not enough room for red blood cells and thrombocytes to develop. Without erythrocytes, the body's cells do not get enough oxygen, and the condition known as anemia develops. Without thrombocytes, blood cannot clot properly, and simple injuries can lead to serious blood loss. Thanks for listening and keep studying.